And really, she was wrong, and you could wind up paying for it with your pocketbook, your health, or both. So Lynne Brenner is going to help us get a little bit smart about open enrollment. She's a contributing editor at Parade magazine. Lynne, welcome to the program.
Thank you.
You know, you get the thing in the mail, you get the email from work. They say it's that time of year again for open enrollment, and we all roll our eyes. We know that it's an important decision to make. And in fact, you know, I've made the wrong decision before, you know, and found out suddenly that I'm paying more or that I'm not covered on something. What's the first thing to do?
Well, block out some time for it. I mean, you're going to wade through a lot of papers, and it's time consuming. The first thing to do is to take a really good look at what you have now. What's wrong with it? What are you spending? And then once you've got that benchmark, here's what I've got now, take a look at what your alternatives are. And you're going to look at the cost, what are the premiums, what are the deductibles, what
They're all going up, by the way.
They're all going up. Yes, absolutely.
You're going to pay a little more. If you think you're not, you're going to pay a little more.
Yeah. And so you're going to compare the costs of the different options. And you're also going to look at, are your doctors in the plan, in the alternative plan? It's a good idea to ask the doctor. Don't just rely on the insurer's website that lists all the doctors, because they're very often not up to date.
And sometimes, you know, the nurses or the office manager will tell you, you know what, we haven't been happy with them and we're thinking about dropping them.
Exactly.
Right.
That's important to know too.
Exactly.
You don't want to find that out in the middle of your year.
No. So that's how you do the basic comparison, and then look at what are your maximum out-of-pocket costs going to be with these different plans. One of the things that people are being offered more and more these days is what's a very high deductible plan. It's going to, the good news is that it's the lowest cost plan, you'll see. And it's very seductive. It very often comes in combination with a tax-deferred savings account.
Right.
The bad news, which you really have to pay attention to, is that your out-of-pocket costs with that plan are going to be substantial. If you're young...
Unless you never go to a doctor.
Well, unless you never go to a doctor, you know.
Which is what we all hope for,
well,
really.
Yes, of course, but the reason you have insurance is to cover you in the worst-case scenario. So you want to look at, with this high deductible plan, what is the worst-case scenario? I mean, even a young, healthy person can be in a car accident.
Right.
So you want to do a what is the maximum out-of-pocket you could pay? Some of these plans, your maximum out-of-pocket could be over $11,000 for a family in a year.
The important thing at this time of the year, too, is to sit down, if you have a spouse, to sit down and figure out what their plan is, and you can weigh. Sometimes you have more than just the choices that you're given at your job, because and if you have children, you can start looking at the family plans and one or the other, and you start to weigh.
Right, it starts to matter more than if you're a guy living alone. I can figure out my own health care.
A completely healthy guy living alone.
Completely healthy.
Yeah, who's never going to have an accident.
Never going to have an accident.
Never. Well, no, absolutely compare it with your spouse's plan. And when you look at those deductibles, bear in mind there's usually a deductible for each member of the family separately.
Yeah.
You have to,
unfortunately...
You're underscoring what we were fearing, is that this is not going to be without some work.
Unfortunately, it will take work. On the plus side, you could save yourself hundreds, maybe even thousands of dollars. You know, that's why I say carve out the time. I mean, sit down in one of those rare, nice, quiet little spells.
In all of your spare time to do office work.
Yes.
Lynne Brenner, contributing editor, Parade magazine. Thank you so much for joining us. Thanks,
Thank
Lynne.
you.
Why don't you just do the work and I'll ask
Our
what you
lives
do.
are completely different, you see. So then
I can make my life like yours, not to have to go through the work of figuring out my open enrollment.